Hi, I'm Dr. Neil Schultz. This is viewer question week at both BeautyRx and Derm TV, the third or fourth week of the month, and of course, this is the fourth week of the month. So, welcome to the November episode of BeautyRx Live, where on live streaming video, I'll answer your questions about BeautyRx products or other related skincare issues. Just to remind you, BeautyRx skincare products are the same patient-proven products that have been giving my patients more beautiful, healthier, and younger-looking skin for over a decade. And they now are available to everybody, not just my patients. And in addition, if you have a question, you want to ask me anything about these products or any other related skincare issues, go to BeautyRx Live and just type your question in the chat box. So let's get started with the first question. I have a question from Sandra. I watch Derm TV, so I know how important exfoliating is. I want to try your products, but my skin is very sensitive. Would glycolic irritate my skin? Sandra, a lot of people have what they think is very sensitive skin, and some people do have very sensitive skin. But regardless of which it is, I would suggest starting with the 8% daily exfoliating therapy serum, but we're going to have you test it to make sure that it doesn't bother you. So the first time you use it, you'll use it in an area in front of your ear, maybe the size of a quarter or 2 or 3 centimeters, very, very lightly, and make sure that doesn't cause any irritation. If it doesn't, do that every other night for about a week. And if that doesn't cause any irritation, then very lightly, because don't forget you only use 3 drops to cover your entire face, very lightly, use it on your entire face every other night for a week. And again, if there's no irritation, then you can proceed to the usual way of using daily exfoliating therapy serum, which is to use it every night. But this is the way anybody with sensitive skin would test a new product. And because the glycolic acid in these products is so gentle, with a higher pH, which causes less irritation, most people, even with sensitive skin, can use these products. Question for Mike. Any tips to get rid of huge zit I woke up with on my jawline? Mike, the fastest way to get that to go down is with warm compresses. A huge cyst is really, if you're talking about one of those really red, juicy, tender ones, kind of tough to get them to go away really fast without having them either opened by a dermatologist or a facialist, or even having them injected with cortisone. But warm compresses and, of course, spot treatments with salicylic acid, resorcinol, or sulfur would be the best way to go. Question from Beth. Is there a typical age that acne starts to subside? I'm in my mid-20s and I am still dealing with acne. Beth, there really is no typical age anymore. It used to be in the middle of your 20s or late 20s it would subside. And unfortunately, I now see so many patients whose pimples meet wrinkles. Women who are having acne into their 40s and even into their 50s. And we think it has to do with certain additional stress factors that didn't exist decades ago. But the bottom line is, while traditional acne used to go away early 20s, late 20s, it's actually in many people going on into their 30s, and this is the reason, and 40s, this is the reason why you have to continue exfoliating, because that helps prevent as well as treating acne. So that would be the way I would put that into perspective. Just because you're in your mid or late 20s doesn't mean that you're done with your acne. I just want to get back to Sandra's question. She asked, what kind of acne scars is excision for and how many treatments are needed? Are the results permanent? The acne scars, Sandra, that excision is best for are the ice pick scars. Those are the scars that in cross-section look like somebody took an ice pick and actually stuck it into your skin, and you see these V-shaped or even cylinder, even boxcar, vertical walled scars. Those are the ones that get excised. The shallow rolling ones that look more like craters, they get lasered and they get filled. So the excision of the ice pick scars and the boxcar scars, tongue twister, is very effective, just one treatment. Each one has to be individually excised, of course, but only once. And you get a very, very fine line or no mark at all, but certainly something that's far, far better than the scar you started with. And when they've all been excised, it's then possible, if there are any fine lines, they can be lasered to remove those fine lines. Cindy says, what's good for red marks left by acne? I use the 8% AHA serum from BeautyRx. It's helping to fade them some. The marks are about 4 years old. Cindy, redness left over from previous injuries, whether it's a scratch or whether it's a pimple, that redness represents your body trying to help. It's trying to bring in more nutrients through enlarged blood vessels, which are the pathways and the ducts through which the nutrients come, trying to bring in more nutrients to help heal it faster and better. So if those red spots have been there actually for years, it means your body's making a mistake, and it thinks it needs to keep repairing when it really doesn't. So at this point, those extra nutrients which cause the redness really aren't helping, and it's time then to get rid of that redness. Unfortunately, there is no topical skincare product that at this time will eliminate redness permanently. Of course, you can cover it, you can conceal it, but you can't get rid of it with at-home products, not even my beloved BeautyRx products. So this is a time when you need to see a dermatologist for laser removal of the redness, which is painless, fast, it's not expensive, and it's very easy to do. Let me just remind everybody that this is the November episode of BeautyRx Live, brought to you through streaming video. If you have a question, go to beautyrxlive.com, and through the chat box, you can type in your question, and I'll be happy to answer it as soon as I can. Stephanie asks, I guess we lost Stephanie. If we can scroll back. All right, let's go up to Amy's question. Hi, Dr. Schultz. I have very chronic blackheads on my nose, which I think are genetic. I used a 10% glycolic acid cream at bedtime, a 1% salicylic acid astringent a few times a day, a physical exfoliator every other night, and I gently squeeze out the blackheads after a long shower 3 to 4 times a week. I also just started using a 9% salicylic acid. It's time-release formulation. None of these things irritate my skin, and my blackheads have been getting a lot better, but they're still not under control. What else can I do? Well, first of all, Amy, I think that you have to understand that as you're removing the oil and removing the clogs, you're making more oil. So the fact that you're using a glycolic acid cream at bedtime, I would suggest using a serum, because serums are lighter, either a serum or a solution, and maybe it's time to move up from the 10% to a 12 or 15% product. The 1% salicylic acid astringent that you're using is perfectly fine, but why don't you move up to an astringent that also has 5 or 10% alcohol? The physical exfoliator that you're using every other day, make sure you're using it at the end of the shower after the pores have been steamed so that they're opened a little bit more. And gently pushing them out, as long as you're not increasing clogs, that's okay. But why don't you try making these changes, making sure that you're using your exfoliant, the granular exfoliant, at the end of the shower, increasing the strength of the toner and your glycolic product, and see what that does for you. We have a question from Stephanie. Should we really be using Clarisonic brushes? Very expensive. Rite Aid and Olay have their versions for $20 to $30. What do you recommend? Stephanie, I recommend whatever works. All of these devices are helpful. I don't know that you can prove that the Clarisonic is 10 times more effective than the Olay or the Rite Aid one, since the Clarisonic is probably about 10 times as expensive. But the point is, if the less expensive ones are doing what you want them to do, which is helping to augment the cleansing of your skin, then they're fine. You don't have to use the most expensive. I can't tell you whether in any individual person any of these are going to be better or going to be the same. But the point is, you use whatever works, and if you like using an electric toothbrush, if you like that experience for helping to cleanse your teeth, then you'll probably like the experience because you can hear it, you can feel it, you think you're doing something extra when you're using a cleansing brush. But I'm not sure that you need to use these devices. I think you can get effective cleansing without them, and I'm sure that you can get increasingly effective cleansing if that's what you're after, if you're using any of these devices. So again, if you have any questions, please go right to BeautyRxLive.com and use the chat box. And in that chat box, just type in your question, and I'll be sure to get to it as soon as I can. Okay, let's see if we can just scroll up a little bit here and see what's going on. Okay, I have a question from Stephanie. I'm an African American, 36, normal skin. I use cleanser, toner, serum, eye cream, day lotion with an SPF of 30, and then in the evening, the same as what I've used in the morning, except night cream and then Retin-A. Anything else I might be missing? I want to start using glycolic wipes of 10%, but don't know where to put it in my current routine. I don't blame you. You're pretty busy. You must be staying up late to do all of that. But I'm really happy that you're doing all of that for your skin because it's all good. So let's go back through that list and see where we can fit in a glycolic pad if it's appropriate. Certainly want to use your cleanser and toner every morning and every evening because that helps prepare your skin for any of the active ingredients that you're going to be using. The eye cream that you're using really doesn't have much effect here for the rest of your face. And of course, your day lotion with an SPF of 30 is perfect, giving you more than 95% protection from the UVB rays. And in the evening, what I would suggest, before you're using the night cream, either use Retin-A or a 10% glycolic pad. I prefer glycolic as an exfoliant to retinoids. I think that they're less brittle, I think they're more gentle, and I think you can get just as good or even better results. So my suggestion would be, after you've used your cleanser and toner in the evening, that's the time to use your 10% glycolic pad. Of course, BeautyRx has our advanced exfoliating therapy pads, which is a 10% buffered and pH-adjusted glycolic product to make sure that the glycolic is not only effective but gentle. You would use that next. Put on, at that point, I would suggest using a vitamin C-based antioxidant, like the BeautyRx Protective Vitamin C serum, which gives you the antioxidant protection applied at bedtime so it can be absorbed into the cells overnight. So the antioxidant is on station inside the cells to protect the inside of your cells from ultraviolet damage during the day, the stuff that gets around your sunscreen, even though you're using your day lotion with an SPF of 30, still you need antioxidant protection. So I would recommend using a vitamin C-based product, and then you can go on and use your night cream. So why don't you give that a try and see how that works out. Question from Mike. Thanks again. Is Rogaine safe and effective to use all over my scalp, and does a laser comb work to grow hair? Great questions, Mike. I'm glad the guys are with us today. Again, this is the November episode of BeautyRx Live, coming to you over live streaming video, and I'm Dr. Neil Schultz. So, Mike, yes, Rogaine is safe to use over your entire scalp. It comes in two different concentrations, 2% for women, 5% for men, and of course, I would recommend the 5% product for you to use twice a day. And if after 6 months you're not seeing any effective or appreciable increase in hair, you might consider getting a prescription for Propecia, which is the brand name for finasteride. 1 milligram a day has been shown for almost 2 decades to be very effective in helping guys regrow hair and stop losing hair. In terms of the laser hair comb works. It just doesn't usually work a lot. But certainly, the studies that were done when it was first introduced demonstrated an increase in hair growth. For many people, that increase may only be 5%, 10%, or even 20%. But what's wrong with even a modest improvement as long as it's helping to grow some more hair? And if you put that 5, 10, or 20% together with the improvement that you can get from your Rogaine, it all adds up and it all helps. So as long as you don't have a problem with the laser hair comb, and as long as the expense is reasonable, sure. If you're losing hair, I recommend using as many different modalities as is possible that are safe to help regrow your hair. Question from Sophia. Is a 10% glycolic AHA liquid good to use daily with a pH of 3.0? How much free acid is in it? Sophia, let me just remind you that when you say 10% glycolic AHA, all glycolics are AHAs. AHA just means alpha-hydroxy acids, and the most common alpha-hydroxy acids are lactic acid, malic acid, citric acid, and of course the most effective one, glycolic acid. So glycolic is always an AHA. A 10% liquid at a pH of 3 is probably going to give you a free acid of between 6 and 7%, which is going to be pretty strong. And the pH of 3 is kind of low. That's pretty acidic. So you can have a pretty potent product that also has the potential to be a little bit irritating at a pH of 3. So be careful. If you get some tingling when you put it on, and the tingling goes away in 20 seconds, that's okay. But if you get stinging, and that stinging lasts for a few minutes, or if you're getting redness from it, then that might be a little bit too strong for you. So after doing this for a year, I finally figured out how to scroll through the questions. So just stay with me while I make sure that I haven't missed anybody's questions. My technical advisor here is cracking up, thinking how accomplished I am with buttons and bits and bytes. So let's go on to Nora. Hi, Nora. How you doing today? Hi, Dr. Schultz. Thank you so much for your time. My question, how to remove tanning from hands and feet? Well, if you're talking about the tan that you get from an artificial tan, the easiest way to do that, if the tanning solution has caused too much darkening, the best way to do that is to exfoliate, because artificial tanners work on the basis of staining dead cells. And what does exfoliation do? It removes the dead cells. So using more effective and more frequent exfoliation is how you would remove that extra tanning. And by the way, one of the reasons that some people don't like to use self-tanners is because they're afraid they're going to get an uneven self-tan, or they're going to overdo it. And this brings up a very good point, and the reason why you shouldn't be concerned about that, because even if that did happen, you can adjust the excess tanning by using more frequent and more effective exfoliation, which is exactly what I'm suggesting here for Nora. So more stronger glycolic, more frequent glycolic. Now, if we're talking about the kind of tan that you get from UV light, well, it's going to depend on whether it's on the back of your hands or on the palms of your hands, and of course the feet as well. It's very unusual to get tanning on your palms. So let's assume that we're talking about the back of your hands. And in this case, the most important thing to do would probably be to use a bleach. You can either use 2 or 4% hydroquinone, or the BeautyRx Brightening Complex, which is a peptide-based hydroquinone-free brightener, which helps to fade UV-induced pigment faster. And of course, you're going to want to use a very effective broad-spectrum sunscreen like the BeautyRx Maximum Solar Defense Sheer SPF 50 every day to prevent further darkening, and also exfoliation every night. So if this is natural UV-induced excess tanning, it's a threefold attack with effective sunscreen to prevent more of the tanning, and a bleach and an exfoliant. If this is from a self-tanner, then all you need to do is use the exfoliant to lighten it up and make it go away faster. Sophia asks, is ascorbic acid the same thing as ascorbic? Okay. It really is L-ascorbic acid, the same thing as ascorbic acid. Yes, most acids can occur in different photoforms, L and R, and when they say L-ascorbic acid, they're really talking about regular vitamin C ascorbic acid. And Mary asks, are there any preventative treatments for the neck? Mary, don't know how old you are, don't know what you want to prevent, but if you're talking about sagging skin, like this type of sagging skin, I don't know any way to prevent that. If you're talking about necklace, collar type of lines and wrinkles that go horizontally, certainly sun protection is going to help that, because those types of lines are caused by sun damage, not having adequate sun protection, and they're also caused by a lot of excessive movement, this kind of stuff. But we're not going to tell you to stop shaking your head or moving your head. So Necks are best dealt with in a preventative fashion with effective sun protection, and starting to treat them early also for those fine lines and wrinkles with exfoliants and peptide products that can generate more collagen. But for the gravity stuff, which is causing hanging like this or extra tissue, I don't know that there's a way to prevent it, but I sure know a lot of plastic surgeons that can do a very, very fine job of removing that and helping it surgically. Again, this is the November episode of BeautyRx Live, coming to you over live streaming video. If you have a question, please go to BeautyRxLive.com and use the chat box to ask me a question. I'm Dr. Neil Schultz, and I'm going to try to get to as many of your questions as you can. Keep in mind that previously BeautyRx skincare products were only available to my patients. Now they're available to everybody over the website and in certain spas and certain other websites like drugstore.com and on Amazon. So they're available any place that, in most places that you would conventionally go for these things. And if you have any questions about them before you get them, after you get them, that's what BeautyRx Live is for, to try to answer as many of your questions as I can. And by the way, it's dermstore.com, not drugstore.com. So thank you, Stuart. And I believe that we've taken care of Ella Scorbic. Okay, so let's go on with a question from Mary. Would you recommend Retin-A? I found a product. First ingredient is silicone, second vitamin C, then niacinamide, then retinol. Is it a good product? Okay. Well, first of all, as the percent of retinol is 1%, and under the most ideal circumstances, if all of that retinol were absorbed, it has the potential in your skin to become 0.1% Retin-A, which is an effective dose of Retin-A. But that absorption and then conversion of 1% retinol to 0.1% Retin-A is really only provided that, number one, the moons are lined up properly. Number two, you've been exfoliating beforehand to make sure that the absorption can be complete. Number three, that the form of retinol is pharmaceutically high grade so that it actually is going to be active. And the point that I'm making is there are many variables involved in achieving that dose of Retin-A in your skin from retinol. Most people who've been following Derm TV and who know me understand that as exfoliants go in both Retin-A, all the retinoids, Retin-A, Differin, Adaptoline, and glycolic, they're all exfoliants, but I believe that glycolic is the gold standard in exfoliants because it's just more effective, less brittle, and there's a wider therapeutic range for at-home products from 1% to 20%, as opposed to retinoids, which if you want to put the active retinoid on your skin, you have to get a prescription for it. And there isn't a day that goes by that I don't get a viewer question on Derm TV about people who've gotten irritated with retinoids, and that's what I mean by they are brittle. The range between the dose that works and the dose that irritates is so small that so many people get irritated with it. So I'm a big fan of glycolic for exfoliation. The other ingredients in your product, the vitamin C and the nicotinamide, those are all good ingredients. The silicone obviously is acting as a barrier to help keep things in, and also as a way of spreading and a vehicle to help deliver the ingredients. So in general, I have no problems with this product. I don't think you're going to get as effective exfoliation with it, though, as you will with the glycolic-based product. Hi, Mario, and thanks for your question. Are there no side effects to applying on a daily basis low pH products such as glycolic lotions? Mario, if you're going to use low pH products, regardless of whether they're glycolic or anything else, on a regular basis, I bet you're going to get irritated. Now, of course, low pH is a relative term. We know that the pH scale goes from 1 to 14. 7 is neutral. Your skin is a little bit above 7. Most of the pKa of glycolic, meaning the pH at which the glycolic is 50% bound and 50% free, and it's the free acid that does all the work, pKa is 3.82. So in my view, when you say a low pH, we're talking about a pH below 3.8. We had a previous question about a 10% glycolic lotion at a pH of 3, which I said would probably give you a free acid percent of about 7. And I mentioned that that pH of 3 is getting kind of down there, because don't forget, each number that pH moves is a tenfold change. So 3 is 10 times more powerful than a 4. And 2 is 100-fold more acidic than a 4. So you have to keep that in mind, and I don't recommend low pH products for anybody. One of the reasons that I created the BeautyRx exfoliants is because I wanted to find an exfoliant that could be gentle, and gentle but effective. Previously, most glycolic products could be effective, but they weren't gentle because the pH was too low. By certain chemical manipulations, what we've accomplished is raising the pH so it's not too low, and at the same time getting effective exfoliation. And that's why my patients love the BeautyRx exfoliating products. So please be careful with low pH products. Again, I'm Dr. Neil Schultz, and this is the November episode of BeautyRxLive.com. If you have any questions, go to BeautyRxLive.com. Use the chat box, and of course, type in your question, and I'll get to as many of them as quickly as I can. Philip, how are you? Nice to hear from you. Philip Pomeroy. Philip Pomeroy is the nephew of a very good friend of mine. Philip asks, what is your favorite OTC lip moisturizer? And he says, not Vaseline. Philip, I'll tell you who makes really, really great lip balms. Kiehl's. Kiehl's makes great lip balms, and I find them particularly effective for people who have dry lips and irritation from Accutane, which really dries you out. And if any lip balm is going to help with Accutane dryness and chapped lips, then it's certainly going to help with most others. So why don't you give a Kiehl's lip balm product a try, and nice to hear from you. We have another question from Stephanie. Thank you. I was using my vitamin C serum during the day because of the antioxidant protection instead of at night, as you just recommended. Therefore, what type of serum should I use in the AM? Also, I put the Retin-A on after the night cream, so I should be using night cream and then Retin-A? Oops. Well, Stephanie, oopses are okay. I mean, that's why we have these questions, and that's why we have BeautyRx Live to help you with this stuff. First of all, your moisturizer would be the last thing you put on at bedtime. You always want to put your actives on under your moisturizer, so the moisturizer doesn't do anything to impede the penetration of your active ingredients. In terms of what serum should you use during the day, since I've mentioned and you've realized that the antioxidants work most effectively, topical antioxidants work most effectively at bedtime, during the day, I actually recommend that people use their sunscreen, obviously with a minimum SPF of between 15 and 30 with broad spectrum or UVA protection, and as little else as possible. A moisturizer on top, if necessary, sure, but I try to make sure that the sunscreen really isn't affected by other things unnecessarily. So when you say serum during the day, if you're talking about a moisturizer, you can use whatever moisturizer on top of your sunscreen that you want, but I would try to put most of my actives in the evening, whether they're exfoliants, whether they are antioxidants, bleaches, peptide products. I try to move them all to the evening. Question from Sophia. What's a good exfoliant to use on the feet? Urea, glycolic, or BHA, and how much? So, Sophia, well, BHA, of course, is salicylic acid, and salicylic acid comes in pads of about 40%, which are like plasters, and they help, but they're a little awkward to use. In terms of AHAs, I love 20% glycolic, either cream or gel, as an exfoliant for the bottom of the feet. And the bottom of the feet tend to get thick and flaky. Some of that is callus formation just from normal wear and tear, and some of that actually is the result of fungus infections Some of that actually is the result of fungal infections, which many adults have. And when you see me looking down like that, it's because I'm looking at the questions that are coming in and comments, and I'm trying to keep this all together. So my favorite is 20% glycolic. There is a BeautyRx product which is called Prescription Strength Exfoliating Cream, which is what I give to my patients, and that's my favorite. You had a question about two others, which was one other, which is urea. Urea is a wonderful exfoliant, 16%, 20%, reasonable to use if you can find it. The bottom line is all of these things are going to work. Conventional salicylic, or BHAs, which come in acne lotions, which are going to be 2%, that's not really going to be helpful. So go for a glycolic if you can. And we're going to see if we can get one more question in because we're running a little late. Okay, and Mary asks, is it true that skin acid mantle is a pH between 4.5 and 5.5? Some websites suggest that you should be using between 3.8 to 6.0. Is this true? This sounds kind of silly. I'm not sure I understand the question completely. But first of all, the skin does have an acid mantle, meaning that the pH is slightly acidic, but it's certainly not a pH of 4.5 or 5.5. It's certainly very close to 7. So in terms of the skin itself, it's very close to 7. In terms of the products that you're using, products with a pH of 4.5 or 5.5, they're not too acidic to use on your skin. Most products actually do have pHs that low, particularly exfoliating products, acne products. But don't forget what I said about my considering a low pH to be a pH that's below 3.8. So let me thank you all for your great questions, as always, and for tuning in to the November episode of BeautyRx Live. Please join us next month in December, the third week, for Viewer Question Week. Please keep sending your questions to Derm TV. Your questions are great. So many of the episodes at Derm TV are based on your questions. I hope that you all had a nice Thanksgiving, and looking forward to great holidays, and I'll see you in a couple of weeks. So this is Dr. Neil Schultz from BeautyRx Live, and here's to happy and healthy skin.